Hi, I'm Dr. C. If you're dealing with back pain, you've probably heard of the terms sciatica and spinal canal stenosis. But how are they different? And how can you tell which one you might have? I'm here to break it down for you. Sciatica is a symptom. It means you have pain that shoots down your legs in a very discrete distribution. It tends to feel worse if you bend forward or sit down, and most people feel most comfortable lying down on their backs with their legs elevated with pillows underneath them. Spinal stenosis, on the other hand, is caused by narrowing of the spinal canal. This narrowing compresses the nerve roots as they travel through the canal, and some of the symptoms that are felt may be related to decreased blood flow at the level of the nerve. This often leads to symptoms of cramping in both legs, particularly when standing or walking, and this cramping will improve when you sit down. In fact, most people with spinal canal stenosis describe a limit to how far they can walk before they start to feel as if they're just traveling through quicksand. But if they're able to sit down, even for a couple of minutes, the symptoms will completely resolve and they're able to get up and resume their tasks again. People with spinal canal stenosis often find themselves leaning on the counter in the kitchen while they're working, or pushing the grocery cart so that they can lean on it while they're grocery shopping. Sciatica generally affects the young or the middle-aged. Spinal canal stenosis is more a condition experienced by the elderly. The stenosis is caused by arthritis in the joints at the back of the spine, as well as degenerative changes in the disc causing bulging into the spinal canal. Both of these conspire to narrow the spinal canal and compress the nerves as they're traveling through the space. Sciatica is generally due to a discrete disc bulge or disc herniation, or even a bone spur that impinges a very specific nerve. And as I've said, it's usually only in one leg. So if you're wondering which of these problems you might have, think about these questions. Do you get sharp pain that shoots down one leg? If you do, that points towards sciatica. Do you get aching, cramping pain in both legs, worsened with standing and walking and improved sitting down? That points towards spinal canal stenosis. Obviously, this isn't a diagnosis. There's a lot more that's involved in confirming the diagnosis, but this gives you an idea of where to start your conversation with your doctor. If you want a more personalized breakdown, I've built a tool called Pain Finder. It's free, and it may help you better understand what's causing your pain. And understanding what's causing your pain is the first step in finally getting some relief. I'll put a link down below for the Pain Finder app, and you can go and try it out and see if it helps you understand what's going on with your back. I'm Dr. C. Thanks for watching.